Good morning. My name is Inga Cotton. I'm the founder and executive director of San Antonio Charter Moms. And today I wanted to talk about the public health guidance that the Texas Education Agency issued yesterday afternoon. And the link to the document is in the description of the video if you want to click on it and download it yourself. So it's about 9 pages, single spaced. And I wanted to offer some commentary about what it says, just so you can kind of be aware. Basically, this is the document that comes from the Texas Education Agency, and then each local school district and each charter school is going to kind of factor this in to they have to comply with this. There's a lot of layers here, right? So for example, the governor issuing a mandate that people need to wear masks, so that the TEA has to comply with that. And the governor's rule about masks, that might change. So it's kind of a fluid situation, but this is a big step forward as far as the TEA has set up these guidelines and schools have to follow them. So I've been following the local news coverage of this in San Antonio, Austin, Houston, and there's some links to that on the page. There's a thread yesterday about that. So if you want to read what the Houston Chronicle or the San Antonio Express News or Texas Tribune is saying about this, that's a we cover. We want you to be informed about the news, so we share those links. Also, our Twitter account at SA Charter Moms on Twitter. That's a really good place to catch the breaking news about education stories. So I know Twitter can can be a little different, but just as far as keeping up with news, it's a good source still. Okay, so what are some key takeaways? One is that since the governor has a mask order, that means that applies to TEA, that applies to individual school districts and charter schools as well. So, but the governor could change that. So basically, don't blame TEA for the mask thing. That's the governor, right? Another thing is that, and this came out in the commentary, it's not, you kind of have to read between the lines in the document, but like earlier in the summer, I was talking about what some of the different options could be. One of them is a hybrid schedule, right? So for example, if you're trying to social distance within a classroom, and the classroom was designed for 20 students, if you only have 10 students in the classroom, they can be farther apart, and that could reduce the risk of spreading coronavirus. One way to do that is to say we'll have half the students on campus in the morning and half the students on campus in the afternoon, or we'll have half the students on campus Monday, Wednesday, Friday, and the other half, Tuesday, Thursday, Saturday, or something. And that was, I remember San Antonio ISD Superintendent Pedro Martinez had a virtual meeting with the Express News editorial board, and the hybrid schedule was one of the things he talked about a lot. Well, TEA has shut that down. So they're basically saying it's either 5 days a week or kids are at home. So it's either remote education or 5-day a week online or on campus. And I don't really know why they did that, except maybe to simplify things. I don't know. Because actually, if you've been a member of the San Antonio Charter Moms discussion group for a while, actually, I'll fly up the URL here. If you're not already a member, I encourage you to join. The group has been very active the last few months as we help parents navigate distance learning or keep your kids busy and safe and learning at home, as we prepare for back to school. So we're trying to share information, but we're also trying to not feed our anxiety too much. So it's kind of finding that right balance. And that's why I'm really thankful for our team, our moderators like Becca, who shares helpful information, but also shares some fun things to kind of lighten the mood. But today we're in serious mode, talking about what TEA says about back to school. So yeah, so it looks like that the hybrid learning model is kind of off the table. But let's talk about what's, what it does say. So on the first page, one thing that caught my eye, they're talking about the recommendations for the American Academy of Pediatrics. And it says that, yes, there are risks of having children on campus because they could get coronavirus. Most children don't get sick. They don't show symptoms. They don't seem sick. A very small number of kids get very, very sick, but it is a very small number. And there just isn't that much data yet about how much children are spreading the disease to adults, right? Because the adults are more at risk. So we really don't know, like, if children get coronavirus at school, are they going to bring it home to their parents? Are they going to infect the teachers? We just don't have enough data yet, and that's scary. But okay, so the American Academy of Pediatrics is saying we need to balance the risk of infection from having kids in school against the risks to children of having them out of school, right? So, things like, are children being treated well at home, right? Vast majority of children are being treated well at home, some are not. Sometimes stuff is getting missed, right? Maybe they're not, seeing the doctor as much, maybe they're not interacting with teachers who might notice a problem and report abuse or neglect. It is a real problem. So it's a balancing of risks, right? Do kids go to school and risks contracting or spreading coronavirus? But the benefits of being on campus is that there's other adults with eyes on them who might notice neglect or abuse or or other risks to the children. So it's a balancing. It's a tough situation. Okay, so the overall areas that the TEA document gives guidance on is providing notice, preventing virus from entering the school, responding to if there is a confirmed case of coronavirus at a school, and then it says mitigate practices to reduce the spread of virus. Okay, so for notice, it says that a week before the start of on-campus activities and instruction, so 1 week ahead of time, the school has to post a summary, and that's going to be on the school website. So we're going to be sharing those, right? So we'll put that on the blog. We'll put it. So you'll be able to go to each school's website to see it, but that's part of what we do is informing parents. So we're going to kind of aggregate and collect those summary documents, and each school just is supposed to designate or each school system is supposed to designate a point of contact person or a team, and include that contact information in the document. And so that's really important, right? Because you got questions, I got questions, right? We all got questions. So yes, so this is good news. Now, 1 week, that's not a lot of advance notice, but I understand if the situation is changing a lot. Yeah. So hopefully school districts won't wait till 1 week. Hopefully they'll post something sooner. But that's the requirement. They have to 1 week ahead post a summary. And it's intended to include a lot of the same information that's in this document. So if you want to, get a head start, basically the districts got this at the same time as the public. So everybody's trying to process this right now, which is why this is topic for Charter Moms Chats today, right? Okay, so anyway, keep an eye out on the school website for the summary document. It has to be there at least a week before people come on campus, and we're going to kind of aggregate that and have a page of kind of a resources page. And actually, I want to mention, so Families Empowered is a Houston-based nonprofit that also is parent-oriented and shares resources, and they have COVID resources for Houston, Austin, and San Antonio on their website. So shout out to Families Empowered. Okay, so yes, and having point of contact at school, I think that's really important. Okay, so some basically for a student to get credit for a course, they have to attend 90%, but they can attend either on campus or off campus. So that's good to know. But it means that the schools are going to have to be keeping track of attendance for the remote education students. So I don't know exactly what that's going to look like. It might mean, logging in at some point, some kind of contact. So let's see. It talks about, okay, so I think we've been starting to see this, that if a parent wants to kind of transition their child from being on campus to off campus or off campus to on campus, the schools can limit that to happening at grading periods. Let's see, if a parent who, let's see, okay, let me clarify. So they're basically saying if the student has been doing remote education and they want to come on campus, the school can say, that's great, but you have to wait until the next grading period starts. And I think that's reasonable because, as far as being able to accommodate students on campus, the schools need to be able to plan ahead on that if they're trying to control how many students are in a particular classroom. So in general, I support, parents being able to choose what they want, but I think it's reasonable for a school to say, if a parent calls up the school and says, I want my child to start attending class on campus, the school can say, that's great, but we don't have room for them until the next grading period starts, and then they can come on campus. I just think that's reasonable. Now, this paragraph, okay, so it's kind of at the bottom of page 2, start of page 3. This caught my eye because I'm curious about what the landscape for this will be like in San Antonio. So let me read this out loud. It says, if a parent requests virtual instruction and the school does not offer it, the parent may enroll in another school that does offer it for transfer students. Interesting. So it's kind of a new form of school choice, but it's for example, if there's a district that only offers on-campus instruction and there's another school that does offer remote education, and the parent wants a remote education, then they have the right to transfer their student to the district that's offering remote education. It doesn't say anything about whether a school could turn away a student who's asking for remote education. I don't know what the geographic boundaries are. Another school, I don't know. Yeah, I'm curious about this. So stay tuned. I'm going to be asking around. But yeah, they may have just created a new form of school choice. This will be interesting. Okay. All right. So it says schools must provide daily on-campus attendance. Okay, I think this is the part that rules out the hybrid schedule, I guess. Now, this part's interesting. So there's a sort of a districts can choose that for the first 3 weeks to be remote only, which is interesting. I think I saw that maybe Laredo ISD has already opted into this, which makes sense because they're kind of a hotspot right now. So the idea is the district can say, for the first 3 weeks of school, everyone's remote, except now there's an exception. If a family does not have internet access or devices, then those students are entitled to come on campus during the transition, right? Okay, so here's how this would work. A school says, our community is a hotspot right now. We don't feel comfortable opening on campus yet. So what they do is they have a very limited opening where it's only the students who don't have internet or devices at home. Those students come on campus. Then 3 weeks go by, and then they let everyone come on campus who wants to come on campus, and other families can stay at home doing remote education. So it's sort of a different transition period for the first 3 weeks. So that's kind of interesting. It'd be interesting to know how many districts choose that option. So yes, and every school system is supposed to notify parents of their rights to have students on campus or not. Okay, so there's a section about prevention, right? This is sort of the screening process. And then in the back of the document, there's a list of COVID-19 symptoms. So they define close contact, and they also talk about what the screening questions should be. So basically, you're not allowed to ask so what's your temperature? Have you had diarrhea? No, not supposed to ask that. But basically you're supposed to ask kind of a summary question, it's a yes or no, do you have COVID-19 symptoms? That's what the screener is supposed to be. It's not supposed to be intrusive, symptom by symptom. Okay, so teachers and staff are supposed to self-screen if they have COVID-19 symptoms, or if they get a positive test result for COVID-19, they have to report that. And then there's a time period. There's a definition at the end of that they're supposed to stay off campus for 14 days, or there's a way that they can get tested twice to prove that they don't have COVID anymore and they're safe to come on campus. Okay, so parents are also, they're supposed to self-screen their kids. If your child has COVID-19 symptoms, or if they test positive, don't send your kid to school. Now it says the school may do screening for students. They're not, they say they don't recommend doing a temperature check, the touchless forehead temperature check. They don't recommend doing that at entry. Partly it's, I don't know, kids don't necessarily get temperature from COVID-19 the way adults do. So the temperature check at the entry is not recommended, but not prohibited. So that's interesting. This is where it helps that I'm a lawyer, right? The may, the must, the should. Okay, so school systems may screen students, right? So parents are supposed to self-screen. schools may screen, um, but it's supposed to be just this summary question, like, do you have COVID-19? Does your child have COVID-19 symptoms? Yes or no? They don't recommend doing temperature checks on entry, but they may do it. So that's interesting. They talk about how to screen visitors, and there's a lot of messaging about like really like don't have visitors on campus unless it's essential. So that makes sense. This may mean I may not be able to tour schools for a while for SA charter moms. It may impact how I can report on what schools are like. I don't know. It's going to be, yeah. I mean, in the past year, I did a lot of school guide posts where I would get a campus tour, and yeah, I probably won't be touring any campuses next year. Partly that's because I'm a chicken. I'm isolating and trying to not get sick. And I would hate to be the one who brought virus onto a campus. So yeah, we're gonna have to. SC Trauma is gonna have to function without school tours for a while. Okay, so they talk about yeah, a procedure like if someone either has symptoms, if you have symptoms, you're assumed to have it. If you get a positive test result, obviously you have it. If you want to get cleared, you have to take 2 tests and from an approved lab and show those results, and then you don't have to wait as long to get back on campus. So they recommend. Okay, so what if a student is on campus and they say, "Oh, I think I have a fever," or somebody notices that a student seems sick? They're supposed to separate that student out. They're supposed to clean the areas where that student was working. They, if the student says they feel fever, then a staff, somebody needs to check that child's temperature. So they need to keep the student isolated until like a parent or guardian can pick them up. If anybody is confirmed to have COVID-19 on campus, they have to notify the local health department. But it also has to be done understanding people's privacy rights, right? So you can't just broadcast like somebody's name and say that they have COVID because that violates their medical privacy. It's their FERPA rights. So if whatever area, I don't know, the wording's kind of strange on this. So let me explain. It's on page 5. It says schools must close off areas that are heavily used by the individual with the lab confirmed case, student, teacher, or staff, until the non-porous surfaces in those areas can be disinfected unless more than 3 days have already passed since that person was on campus. So I guess that means if a student is sick, they have to like close off that classroom, disinfect it. I don't know. So it's not clear. We'll see how schools implement that. So if there's a confirmed case on campus, they have to notify all teachers, staff, and families of all students. But again, they have to protect the privacy of the person who got the diagnosis. Okay, next section, mitigate. So they talk about hand washing, right? Having hand sanitizer and hand washing stations at entrances, having and in every classroom. They should talk about like teaching kids how to wash their hands better. So they want to like supervise hand washing to make sure the kids are doing it right. When kids get on campus, they need an orientation about proper hand washing. They talk about having the kids wash their hands at least 2 times a day after using the restroom and before eating. They talk about covering coughs and sneezes with a tissue or the elbow, right? Throw the tissue away and then wash your hands for 20 seconds. Talk about like more frequent cleaning of classrooms, like repeatedly cleaning the surfaces that get touched a lot, right? Like doorknobs and art supplies. It says common tables, desks, shared supplies, shared laptops or tablets. So if a group of students leaves the classroom and another group of students comes in, it's supposed to clean the commonly touched areas in between those groups of students. There's a link to the CDC guidelines. They also talk about making sure the cleaning supplies are stored safely, right? So keep them out of reach of the kids. So they recommend opening windows or otherwise work to improve airflow, which in the Texas climate, that's hard in the summer, right? It gets really hot and humid. But it's interesting. I mean, our buildings have been built to be, energy efficient, kind of, sealed up, climate controlled. I don't know. I wonder how this will affect architecture, right? I mean, I don't know. That's a whole nother topic, but Yeah, it's an interesting thought. Now they talk about this is kind of a so if the building's been closed for months and then you reopen the building, you have to make sure that the water system is safe, right? So if you've had water standing in pipes, you got to kind of flush that out so that people don't, you know, yeah, make sure the water's clean in all the pipes before you let people use it. They talk about the CDC posters that you can print and stick on the wall, or you can make your own version. Um, so they talk about masks. So what they mean are like the disposable surgical masks, or like, well, non-medical grade, so disposable masks or cloth face coverings or full face shields. And so what's interesting, they actually sort of recommend face shields over the other products. They say face shields may be superior to cloth face coverings in many circumstances, given improved ability to see mouth movements and improved air circulation. Um, I don't know if I necessarily want to improve the air circulation. Thought that was the point, but I guess what they mean is like having it be more breathable, right? And that you can see facial expressions for the people who are hearing impaired. They can read lips through a face shield. It's interesting. I don't know. I don't own any face shields yet. I might explore that. I mean, hopefully some of I think early on, I think back in March, a lot of the caution, was people were worried that, individuals like us, it was better for individuals to just stay home and let the frontline workers have the PPE. At this point, hopefully production's ramped up and there's enough PPE to spread around. Okay, so in addition to the executive order, school systems may require use of masks or face shields for adults or students for whom it is developmentally appropriate. So that's interesting. Okay, so basically the governor's order kind of sets the floor. Districts could go beyond that in requiring masks or face shields. So it'd be interesting to see how that plays out. They talk about extracurriculars. Now, TA does not regulate UIL sports, right? So that's a different, right? UIL, which is, for the higher ed system, that's what's setting the rules for UIL sports. But for non-UIL sports, the districts and schools set policies for that. And what they're describing is basically like you show up for practice or whatever with your mask or your face shield. And then once the students are all spread out, if they're on a field doing a workout and they're all at least 6 feet apart, then it's okay to take off your PPE, because you're breathing heavy and you're working out, but then put it back on so that when you're, going through the exit and you're not physically distanced anymore, then you're protected again. So that's kind of how they're describing that. Like, so they're not saying like, yes, you have to keep your mask on, while you're trying to run a 50-yard dash. Like that's a little hard. So that's interesting. They talk about, okay, student teacher groupings. So they say in classroom spaces that allow it, consider placing student desks a minimum of 6 feet apart when possible. Interesting. Okay, so that would require having fewer students in the classroom though, right? I mean, and they're not allowing hybrid schedules. So yeah, this will be interesting. Okay, so this one got me. Okay, this is kind of at the bottom of page 6 because I read this and I was like, does this feel safe? So really like find this in the document. And in fact, maybe I'll put it in the comments. Just think about this statement and think, do you feel safe having your child in a classroom that's following this procedure? Because this is what the TA allows districts to choose. Districts may choose a higher standard, but this is the minimum, this is the floor that the TA has set for campuses to be able to reopen. Okay, here we go. So we're on page 6 under student teacher groupings, number 2. In classrooms where students are regularly within 6 feet of one another, schools should plan for more frequent hand washing and or hand sanitizing and should consider whether increased airflow from outdoors is possible. Okay, so just ask yourself, does that feel safe? Okay, so students are regularly within 6 feet of one another, and they're encouraging more hand washing and hand sanitizing, and increase airflow from the outdoors when possible. Although at my daughter's school, there's a lot of classrooms that don't have windows. They just don't. They're in the basement. Yeah, so no outdoor air there. Yeah, and most of the classrooms don't have a place to wash hands. I mean, they can have hand sanitizer. So, assuming there's, lots of students in the classroom, they're within 6 feet of one another, and given, maybe what you've read about aerosols, right? About like people who have coronavirus and they breathe out, and there's tiny, tiny moisture particles in the air, and those moisture particles may contain virus, right? And if it's a very small particle, it can kind of hang in the air for a while, and the air could sort of circulate around the room. And maybe other children in the room or the teacher might be breathing in those tiny, tiny droplets. And if the exposure happens over a long enough period of time, the virus load that gets in your body might be enough to infect you. Um, so, yeah, um, that's. I'm not a scientist, but I'm just putting this out there. This is what the document says. Um, it's foreseeing a situation where students are closer than 6 feet, within 6 feet of each other, and the mitigation is to wash hands or sanitize more often, and maybe pop open a window. So just ask yourself if that feels safe. Okay, so they talk about use of non-classroom spaces. Um, like so, yeah. So if you have PE outside, that's probably a good way to go, right? Because there's a lot more breathing going on. Um, they basically okay. So if schools open facilities to the public, they have to follow the governor's executive order for that. Okay, so they're talking about exit, entry, and transition procedures that reduce large group gatherings. So that's an interesting question. That might mean like staggering entrance times. Okay, what they say in the document is like maybe like having markers about where to stand, so that the students are spread out from each other as they're entering and exiting the building. I don't know. This looks interesting. There might be a learning curve here for getting kids to comply. This encourage parents to remain outside during drop off and pickup. So that makes sense. They say, okay, depending on local conditions, don't have assemblies. They suggest putting dividers between bathroom sinks if the sinks are close together. And then they talk about lunch. They said reduce the likelihood the students meet the close contact definition at lunch. So have students eat lunch at their desk, seats that are spaced at least 6 feet apart, dividers on cafeteria tables. For like meal service, have individual plates with disposable utensils. Is a suggestion. For the school bus, they say have students sanitize their hands when they get on the bus. Open windows on the bus. Encourage families to drop off, carpool, or walk, and clean the high touch areas between. So they're not talking about. I don't know. I mean, kids may be sitting fairly close together on the bus. That's foreseeable according to these guidance, these guidelines. Okay, so visitors, they say, people can visit, but they said school systems should restrict visits to only essential school operations. So you talk about employees. So like it basically says you're supposed to work at your job. Okay. They have a link to a training for childcare workers offered by Texas AgriLife Extension. So that's interesting. And then they say reduce in-person staff meetings. So, because that's a way to spread. And then there's kind of an appendix that talks about COVID symptoms, a definition of close contact, and kind of the screening. Like you're not supposed to go into individual symptoms. You're supposed to just kind of ask, do you have symptoms, yes or no? So that is my summary about the TEA's public health planning guidance for the 2020-2021 school year. I think you can probably tell from my commentary that I think the part that freaks me out the most is just this on page 6 about students being in the classroom within 6 feet of one another, and their best defense is hand washing, hand sanitizer, and popping up a window if possible. Yeah. So, boy, this is a tough situation. I would say the local coverage. So there's a good article in Express News. They talked to several superintendents like Edgewood ISD, Northside ISD. How they're responding to it. it sounds like what's happening is a fair number of families are planning to keep their students home, and that by itself, like if half the students stay home with their families, then the half that do go to campus, um, they'll be more spread out from each other, and that makes the campus experience safer. So it may be that that's just how things work out. Um, I think for those of us, like for my family, I am planning at least for the first quarter, to keep doing distance learning, and just my hope is that the distance learning is as robust as possible, and that my kids make a lot of progress, and that they keep learning. I wish I knew more about where they were. The STAR test got canceled last year, um, and it's kind of up to the schools to do kind of placement assessment, and come up with mitigation plans. And that's so like my friends at Mind Shift Ed, they have a petition they've been calling for, having every student, kind of like students who are in special education, they have an individualized plan to help them meet their goals. And I think to some extent, every student is going to need some individualized guidance about how to make up for whatever they missed during the campus shutdowns in the spring, and how to get students up to speed as quickly as possible, even while schools are still struggling. um, it just may not be safe to have all the students on campus again for a while. um, so I support what the Mind Shifted petition of calling for individual plans, so that every student knows, every family knows how to get where their students are at, and how to get them back on track. So yeah, I'll be reading the comments. I'm interested to hear what you all say. If there's something, if you read the TA document and something jumps out at you, drop a comment, and we can keep the discussion going. And like I said, we've got the SC Charmos discussion group where we've been talking about this every day, and probably will continue to do so for a while. So thanks for being on the journey with us, and we'll see you tomorrow morning. Okay, bye.